Okay, good morning for those of you who are in America, good afternoon for those in Africa and Europe, and good evening for those of you based in Asia. So I'm Bruno Meessen, Professor of Health Economics at the Institute of Tropical Medicine in Antwerp, lead facilitator of the Performance-Based Financing Committee of Practice, and I'm happy to welcome you. I'm not alone. We will just share the presentation among 3 or 4 speakers. So I'm here with Inke Mathauer from WHO Geneva, from the Health Finance and Governance Department. We are here with Isidore Sieleunou, so PhD student at the University of Montreal and lead facilitator of the Committee of Practice Financial Access to Health Services, and the main coordinator of this collaborative project. And we are waiting for Danielle from Reason for Development, who is encountering problems to connect with the WebEx platform. So we hope that Danielle will join us in a few minutes. So we will present the PowerPoint, which is introducing the future work of our working group. The PowerPoint has been mainly developed by the coordination group and by Isidore in particular. It just happens that I will present the first slides, but then Isidore will take over, and after Isidore it will be Danielle and Inke, or Inke only. So, okay, let's go to slide 1, and a quick history. So this project came from, well, the kickoff was really a meeting organized by WHO Geneva and Inke and Joe Kotsin team. And it was a one-day meeting in April 2016 where there was a group of experts who were in Geneva for another event who discussed about strategic purchasing and started to map issues on strategic purchasing. In the follow-up of this event in September 2016, the Committees of Practice and WHO organized a one-day event just after the African Health Economic Association conference in Rabat, in Morocco, and we continue to investigate where there were more country experts this time, and we tried to map challenges with getting the strategic purchasing agenda higher, well, to get strategic purchasing higher on the global agenda. So the next step was a meeting organized by Inke and her team in Geneva again, a bigger meeting for 3 days. There has been a lot of let's say products from this meeting. You can access everything is on the WHO website, and there is a report, and the report incorporates really key recommendations for getting all of us moving forward with strategic purchasing. In the follow-up of this, in the direct follow-up of this meeting in Geneva this year, we agreed that we continue the collaborative dynamic, which was excellent in Geneva, and we would continue this collaborative dynamic with a project on collectivity, a project jointly organized by WHO, the Committee of Practice, Financial Access to Health Services, and Performance-Based Financing. This is the project you joined. So many of you may have discovered the Committees of Practice through this process, or discovered probably collectivity. So I will say a few words on both the COPs and collectivity. Okay, so yes, as I mentioned already, we have been publishing materials related to all these different events. On the Committees of Practice, we have a blog and we have a discussion forum. And the WHO has a specific page now with a lot of material on strategic purchasing. Okay, so we will, some of you are maybe not familiar with the concept of Committees of Practice and Committees of Practice in global health. So the concept is really starting from the recognition that there are knowledge holders, there are many different kinds of knowledge holders in health financing. So you can think of policymakers, researchers, practitioners, technical assistants, consultants, and so on. And they live in silos. So the scientists, they read the papers in their journals, but they don't communicate enough often with policymakers. Policymakers, they have the interaction Among policymakers, sometimes they reach out to aid agencies, but still, again, they will be missing some good bridges and a common platform. So we recognized this situation 7 years ago, and we decided to launch Committees of Practice. And this was affiliated, these COPs were affiliated to a platform called Harmonization for Health in Africa. So many members of this Committee of Practice are based in Africa. And the purpose was really, let's connect all these knowledge holders, let's get them working together to share knowledge, but also co-produce knowledge. I want to say a few words also on another platform with a very similar concept, the Joint Learning Network for Universal Health Coverage. This network is operated by Results for Development, and it's a network connecting countries to work together on UHC. It's mainly connecting middle-income countries, but also a few low-income countries, and they share the same vision than us, than the Committee of Practice, that we have to connect South-South experts and make sure that we have better co-production for guidelines, documents, publications, and so on. And so a lot of practices that you will hear about the Committee of Practice are also models practiced by JLN. So just here a slide where I present with a few pictures the kind of activities that we do with the Committees of Practice. We organize face-to-face events. Most of our events are organized in Africa, as we really try to mobilize African experts of health financing. We have a blog, Health Financing in Africa. We have online discussion forums. We also do research, multi-country research. As our members are in many countries, we can involve them and co-produce findings and evidence on health financing. And we have also, we love also to innovate. For instance, we have organized a cartoon contest on UHC, so you may have seen this cartoon before. So that's a bit, in a nutshell, the kind of things we do. We will be, of course, happy to share more with you. Here a slide where I summarize very quickly some information about the two Committees of Practice involved in this project. So one is focusing mainly on performance-based financing, and the other one is covering health insurance, free healthcare, health equity fund, vouchers, universal health coverage, and so on. They organize the same kind of activities, and more actually we do activities together. Just like this working group on strategic purchasing, we found really important to connect people working on PBF and people working, for instance, on health insurance. So both Committees of Practice operate both in French and in English. In terms of members on our online discussion forums, it's more than 2,000 and more than 1,000 on the other. We use the same blog, healthfinancingafrica.org, and the contact person, so Isidore is in charge of the financial access to health services, and I'm in charge of performance-based finance. So we are always trying to implement in a consistent way challenging learning agenda, and so now strategic purchasing is a new common agenda shared by the two Committees of Practice. And our next event will probably be the event that we will organize all together with this working group, with WHO, and with other actors. We want to organize an event on strategic purchasing in 2018. So this is just to give you a sense that this working group is not just for online interaction. We really hope to meet you face-to-face in a few months. So Committees of Practice are funded through different mechanisms, but most of our funding is linked to the activities themselves. So for instance, if we organize an event together, we will ask members to find their funding, and usually their partners are quite keen on sending, while covering the cost for the participation for this kind of event. For this activity, this working group, we don't have funding for the moment. So we bid on our voluntary time, and that's the same with all of us, but most of us are people affiliated to organizations directly involved in strategic purchasing, So your employer is probably funding the work you will do with this working group, and we find that, of course, really fine. This is the way we have been working for a while. But we don't exclude to raise funding for this project. We have been in contact, Inke and myself, we have been in contact with various sponsors who were in the Geneva meeting, for instance. So, okay, that's the background. I will now give the floor to Isidore, who will continue and present some background information about this working group. Okay, no, just a last slide before Isidore. Okay, sorry. There is this slide on collectivity. So many of you have already discovered collectivity through this project. So collectivity is actually a platform developed by the communities of practice. So we receive money from Norway to develop collectivity. And so you will find a lot of projects from the communities of practice on collectivity. The communities of practice are piloting to a fair extent the use of collectivity. We are always adding new features on collectivity. So today we are more than 1,000 members. In 1 or 2 weeks there will be a space for community, so we can create a community of practice focusing on strategic purchasing if we want. So it will become an ecosystem really, let's say, cross-cutting and helping you with many kind of activities. So just keep in mind that collectivity is still under development. So if you encounter problems, barriers, when you use collectivity, do not hesitate to write me an email or to Maxime, and then we will use your feedback to improve the solution. Okay. And just a reminder, don't forget to complete your collectivity profile if it's not fully complete. This is how we can, of course, know each other. Okay, now it's really time for Isidore to talk, and he will present you some background information on this collaborative working group.
Okay, thank you.
Isidore,
yes.
The floor is yours.
Yeah, thank you very much, Bruno. Hope that I'm getting heard. But please, maybe those who are not speaking can mute their mic, because it seems like there are some voices. Okay. Are you getting me, Bruno, everybody?
Okay,
hello?
Okay, Isidore.
Yes, are you getting me? Okay, thank you very much. Yeah, thank you, Bruno. I think I'll go through a couple of slides just to give an overview of the team that finally, we work on this. I mean, on our topic, strategic purchasing and universal health coverage. It was interesting to see, a lot of enthusiasm from experts, and we received 75, application from people who really wanted to join the group, and even now we are still receiving some, some interest from other people. And among those 75 people, almost 1/3 of all those who applied, were from the Ministry of Health, are working with the Ministry of Health in various countries. And we also have, let's say, 25% who worked with research institutions, and 23% are from international organizations. You can see that we have, a quite good balance from, people working with Ministry of Health, from international organizations, and also from institutional research. And among the participants, we also have a quite good balance, with the profile, because we have almost 1/3 who are researchers. 1/4 who are researchers, 1/4 who are policymakers, and around 1/3 who are technical assistants. But we also have some implementers, and that is a good news, because most of the time we we work only, you know, with policymaker, researcher, and technical assistant. It's also good to have implementers, and you can see that we have almost 17% of, you know, of the people who are implementers, meaning that they are really those who are touching, you know, the issue on the ground. And when we look from where experts come, it's really interesting to see that they are coming all over the world, all over the world. Probably mainly from Central and West Africa, but we also have people from South America, especially from Argentina, from Colombia. We also have people from Asia, Pakistan, Yemen, and even from Philippines, from Lao PDR, and also from Ukraine. I mean, it's interesting to see that, yes, experts are from all over the world. And please, Bruno, and if we look at countries that apply at team, we can see that we have 8 countries that apply as team, mainly from Africa, Morocco, Burkina Faso, Nigeria, Cameroon, Ethiopia, Kenya, and Yemen. Those are countries, and also Lao PDR. You can see that we also have Lao PDR that apply as, you know, country team. That we have, yes, we have almost 8 country team. Let's now look at our objectives. We have quite some, several objectives. The first one is to try to come up with a rapid assessment tool to assess countries' purchasing market, coupled with key questions to guide the analysis of a country's purchasing market or specific purchasing agency. The second objective is to gather evidence on the purchasing situation in a number of countries. Remember that we saw countries that apply as a team. I think that those countries, we will see how, you know, to go further and gather some evidence. And the third objective is to draw the lessons and identify key issues through a synthesis, evidence gathering. The next slide, please, Bruno. The fourth one is to create awareness on the subject, bring and keep the subject on strategic purchasing on country's policy agenda. And because we know that there's a great momentum now, there is a, you know, a windows of opportunity, and we need, you know, to build on it. And the fifth objective is to build up and maintain a community of interest on strategic purchasing supporters and thinkers. And then the last objective is to try out and further develop joint learning approach. We really hope that we will be able to, you know, to reach this objective. Next slide, Bruno. If we look now at potential output, we hope that we will work and to be able to, you know, to produce some short briefs on a number of issues. For instance, a collection on reflections in terms of what is the problem, what have countries done, what else could be done. And a second potential output that we identify is to try to, you know, to perform a rapid assessment guide for strategic purchasing, developed and validated. I hope to be able to produce this. And then the third one is, you know, a couple of detailed country study based on the assessment guide, as we previously mentioned on our objective. At the end of the day, we hope that to be able, you know, to assess some countries or to develop, to perform some country studies based on our guide that we will be able to develop. Yes, Bruno? Yes, and how we see the next step, how we will work together. First of all, we think that we'll be able, you know, to create some different groups in terms of thematic orientation in terms of various issues to work on, but also in terms of country focus. Country teams could work on their countries, for instance, or others could join. For instance, I mean, some experts could decide to join, you know, the countries team that have already been set in place. And also, we see that, I mean, one can join in several groups, not because we decided to join, I mean, to focus on the thematic orientation that you cannot join the country teams. You can decide to join in various groups. We think also to set up small groups of 6, 8 people per group, so that the work can be, you know, easily conducted. And we will favor virtual exchange through emails, but also through the platform of Collectivity, as we started with the flagship consultation. We also think about potentially face-to-face meetings, but we need to explore the possibility to organize this, because it's not always an easy work. We need to see how, you know, I mean, we will discuss, reflect on it, and see if this is something that we really need. And finally, we think that each group needs to be facilitated by a person well familiar with the question. And I think this is how we see our work, collectively how we need to work. I will then, I will pass the floor to Danielle, who will try to, you know, to bring up the issue of flagship consultation, because with Inke they try to go synthesize, and then she will try to give us what is the main results. Thank you.
Thanks very much.
Thank you, Isidore. Thank you. Okay. I don't know if Danielle is here, but I propose already to take a first round of clarification questions. So, because there are still a few slides, there will be, the next slides will be about what you shared with us in the flash consultation. But, okay, Danielle joined us, but just before, are there any clarification questions on the computer practice and on this working group? So you can decide, you can ask to speak, and Valérie will give you the floor. So, or you can type also your question. Okay, let's take 5-10 minutes. So if you want, you can raise your hand on WebEx. If you want to, if you have a question, you can raise your hand.
Donc on va compléter avec ça. Il faut compléter ça déjà. En 2013. Tout le reste c'est bon.
So, Valérie, can you give the floor to Laura Downey?
De présence, on va faire passer ça.
Voilà, Laura, you can speak now.
Thank you. Can you hear me?
Yes, we can hear you very well.
Great, thanks. I have just a couple of questions. One was particularly related to the fact of building a rapid assessment and developing and validating that. I was wondering what kind of timelines you were thinking of for that.
Tu veux quoi? Lequel? Dis-moi. Ça?
So, Isidore, je me demande si c'est pas toi qui a un background, un fond un bruit sonore dans ton fond. Mais il y a quelqu'un qui a un bruit sonore en français. Et donc, Isidore, je me demande si c'est pas toi. Donc, Laura, you asked the question of the timeline for the.
Right.
Okay, I will try to answer quickly to the question raised by Laura. In terms of timeline for validating the tools and for collecting the data, so we believe that this is a process, and it will take obviously several months. So we are not in a rush. We believe that, well, it will take us a long time to get strategic purchasing on the agenda in many countries. So we will go step by step. So at this stage, we believe that the process is as important as the outputs we may produce. So we don't want to go too quickly. We want to be sure that you really enjoy the process and that you really feel that you are, and the full reality should be that you co-produce the knowledge from developed by this working group. And so our main concern will be that you really enjoy the process and you really feel that you are owner of this process. So we don't want to put too strict deadlines, but obviously we have to make steps. We have to make progress because we want to be very credible to the eyes of stakeholders, your government, WHO, aid agencies, sponsors, academia. We want to be accountable. We want to be recognized as making a real contribution. So we will progress, and we have to decide the kind of steps we want to make. So the objectives which have been identified are objectives we believe will help us to progress in the right direction. So I don't want to give a clear answer maybe to your question, but I hope that you get the sense of behind this project. And maybe later Inke will also contribute on this question.
Yeah, thank you. That's reassuring.
Okay, Valérie, can you give the floor to Deva Narayan Devadasan?
Je cherche.
Narayan Devadasan from India.
Voilà.
So just hold on, Deva.
Yeah,
okay, Deva, I think the floor. Go ahead, Deva.
Yeah, I just wanted to share, it's not a question, but I just wanted to share that here in India, the Institute of Public Health has been asked to come up with a document on how to assess strategic purchasing in the Indian context, and we have been submitted by the end of the year. So I'm really definitely working on this, but I would really appreciate if we can get more help from the collectivity group.
Hi, Deva. So the sound is very bad. So it's really better that you mute your mic and then you type your question.
Okay.
So
I'll do that, yeah.
Deva, we recommend you to please. Deva, so I recommend you to mute your microphone and to type your text.
Yeah, okay. We'll do that.
Okay, thanks, Deva. Because indeed the sound is terrible. But I understand that you are upset about how we will compare across context. And so please develop your question. Maybe it will be clear.
Eric Bijiremana souhaite poser une question, peut-être? Je lui donne la parole.
And in the meantime, we will read the message from Deva. Okay, Eric, please.
Bon, en fait, c'était pas une question parce que je pensais que j'allais libérer ma voix au moment que je veux, mais j'ai compris que c'est Valérie qui nous autorise à parler quand on a une question. C'est pas pour le moment que je vais poser la question.
Okay, no problem. Thank you, Eric. Okay, so hold on. We still wait for the comment from Deva. So, Danielle, I understand that you join us. So, can you just make a test? 1, 2, 1, 2, Danielle.
Can you hear me?
We can hear you, Danielle. Very good. So, okay, I propose maybe that I propose that we go on with the PowerPoint. We will get message from Deva later in the session. So Deva, just take time to write your question, and we will be sure that we will address your question later in the PowerPoint. So let me just close. Okay. Okay. Do you see the screen, Danielle? I think you can go on.
Wonderful. So thank you all. I'm going to start just describing to you the flash consultation that we just conducted and some of the results. So thank you all for your participation. We had a rich breadth of experience that was presented. We had around 30 people submit different thoughts on key issues and challenges that they're facing around strategic purchasing. We then had 2 independent assessors from our team go in and analyze the qualitative responses. So we went through all of the responses and tried to pull out different core thematic areas that emerged, and then cluster other issues as sub-themes under these thematic issues. So next slide, please. So if you look here, we can see that there are on this slide and on the next slide afterwards, a set of core thematic issues. So we had 5 that emerged, as well as frequent sub-themes under each of those and a list of other sub-themes. So you should see your response somewhere reflected here. And so the core themes, and I'll just read them out and allow you to look at this yourself. But we had governance for strategic purchasing. We had distinct issues that emerged with multiple purchaser markets, which included donor-funded vertical programs. We then had issues related to direct issues with provider payment modalities. Next slide, please. We then had issues related to information monitoring, evaluation, and information management systems. A set of issues related to benefits package design. And then we had 3 cross-cutting issues emerge. One around different capacity gaps for strategic purchasing. A second area around regulation and enabling the private sector. And then a last bucket around political economy. So I'm not going to read out all of the different sub-themes and other sub-theme areas that emerged, but this is just to give you a sense of the breadth of responses that we received. Over.
Okay, then I think I can continue. Can you hear me?
Very good. So go ahead,
Okay.
Inke.
So also, hello from my side. It's great to be here to discuss with you. I'm Inke Mathauer from the World Health Organization. And yes, I'm going to continue outlining a little bit the results, what you actually have responded on the flash consultation. And let me just say a little bit on why we started this flash consultation. We had this rich response and this huge amount of colleagues being interested in this collectivity and applying, more than 70 people. And so we thought there's really a huge diversity and lots of rich expertise and background. And so we thought, instead of already proposing some themes for this joint learning agenda and for the joint work and collaboration, we thought we start really on the basis of what you see, what you describe as core priorities, as key issues. And so the flash presentation is really about the what of this collectivity collaboration. And in a way, when I looked at the flash consultation responses, I was really how should I say, positively surprised to how close actually the issues that you raised are sort of in line and reflecting what we at W2, or how we at W2 conceptualize strategic purchasing. And so in that sense, it's really great to see for us and for this whole group, how we actually meet your thinking and your description. And I really have the feeling, we're starting with the same line of thinking. So while I'm presenting now these 5 core themes, this is nothing carved in stone. It's just really a way to start the discussion of what we can work on together, what could be the potential groups or working groups, the sub-working groups to work together. So I'm presenting here these key themes together with some core policy questions. They're just meant as an illustration, they're examples. Many of these questions actually were directly in your responses. Some other questions are in a way a turning around of your of your responses where you described the challenge and we kind of turned them into key questions. So certainly there's much more, there was much more in your responses, much more richness, but on the other hand, of course, we have to somehow bring it together and we have to see on how many questions we can work in one of these subgroups. So let's see this as examples, and it doesn't mean that other questions shouldn't come up. So with respect to governance and strategic purchasing, I think a number of times this first issue was raised about what is an adequate level of purchaser and provider autonomy. Obviously, this needs to go together with capacity, needs to be commensurate with capacity, needs to go together with the mandate of the purchaser. Another key issue was how to ensure stakeholder engagement in purchasing decision processes. And here we're not talking just about different ministries, or employers, employees, sort of as this classical tripartite stakeholder setup, but I think we have to think much wider. There are provider associations, there are patient associations, user associations, citizen representatives, etc., etc. So we have to think quite widely in terms of stakeholder engagement. Another issue was about enforcement of purchasing-related regulations. Yes, there are lots of legal provisions, and you gave examples from your countries, but then the issue that came up was actually how to enforce them, how really to make sure that the various actors, the stewards, the regulators, really put that in practice. Another question was what is an appropriate separation of functions and tasks between the steward and purchasers? Now, there's no blueprint, and probably in each country this might slightly differ, but really starting to think about what is an appropriate separation of functions could be very helpful, I think. Capacity was another key issue, and I think it's a cross-cutting theme that doesn't just come under governance, but it will come in the other themes as well. The question is really how can capacity be strengthened? And last but not least, how to set up effective monitoring and evaluation processes and mechanisms. Next slide, please. Very much related to governance of the specific purchaser, that was what the previous slide was about, is the question about how to govern a purchaser market. And from your examples and from the issues you raised, we know that in many countries the purchaser market is it consists of multiple purchasers. First of all, it's very fragmented, it's non-coordinated. That could lead to double coverage. That was an issue that was raised several times. Or, it also means that certain population groups have no coverage at all. And so with multiple purchases, there is a risk that the pools get very small. Now I can't see the slides. I don't know what happened. It's completely, Bruno? Yeah, great, thanks. So the first question is how to reduce system fragmentation. System fragmentation, of course, is very difficult, both politically as well as technically, or I should say the other way around, technically speaking, but also politically speaking. So if that's not so straightforward, what are other options to actually enhance the strengthening purchasing powers of the various purchases? It's not just about the pool size, but what are other mechanisms, what are other options? A couple of the responses that you had sent in on the flash consultations were around a regulatory body that would sort of oversee, govern, manage this multiple purchaser market. So how can such a regulatory body be set up, and what can it do to increase harmonization within that purchaser market across the different purchases? And also very frequently raised was the issue of vertical programs, often coming from separate donor funding streams, and how can these vertical programs be integrated? How can fragmentation be reduced, and how can the harmful effects overcome? Next slide, please. The third theme that we identified is on provider payment and selective contracting. Now, again, as you see already from the list of questions, this is a quite comprehensive and a big issue. I mean, the question really that I'm raising is whether it would not even make sense to have two groups working on that. So provider payment issues on the one hand, and then possibly selective contracting and accreditation on the other hand. I mean, this came up in many responses from you. But I guess in most of the countries, or in many of the countries, a key question is still how to shift away from line item budgets and unmanaged fee-for-service payment to more output-oriented payment methods. And somewhat related there to how to reduce balance billing, which is just such a frequent practice in many countries and was raised by you as a big concern. Obviously, when it comes to setting provider payment methods and rates, information about costs is needed. But then comes the question, well, what kind of costing is undertaken? Are we costing the existing situation with built-in inefficiencies, or are we looking at the cost of a sort of ideal normative situation? So that's not so straightforward. And in fact, the question was raised by you in this way: what is the role of costing and which methodology is adequate? Maybe I don't go through all the questions here, but maybe just again the next one. With respect to decentralized systems, a question that came up, or an issue that came up several times, was about the resource allocation criteria. How to determine how to set allocations to more remote and poor areas. How can actually these differences be accounted for? And so this is on the one hand a technical issue, as you raised, but you also referred to the political challenges of building in criteria that take account of these differences, these inequalities, and creating inequities. Maybe the last issue here, again, a cross-cutting issue, is how to improve purchase capacity in setting prices. Let me continue, actually, because we really want to keep time for discussion. So let's go on to the next slide. I was very, very glad to see that the issue of information management came up so consistently and persistently. I think it's probably fair to say that this subject hasn't received sufficient attention in the past, although I think one always would agree that this has been a big concern, a big problem. So it's really great to see that your responses really express this demand for putting much more attention to the subject. What follows are kind of assumingly easy questions, but we all know that in practice it's very difficult actually to improve information management systems. So first question is how to better collect better data, so collecting better data on population needs and performance. And beyond that, how to actually strengthen the system, the information management system. Related to the issue of the costing that we just had on the previous slide and on the previous subject was what data is needed to inform costing processes. In several responses or in several country examples that you provided, a question was how to shift from manual to digital information management systems, and also last but not least, how to make information management systems function, and in particular independent of donor funding. For me, that was really a very interesting question that I haven't thought about before, but indeed this is an issue. And then the last slide, please. This is the fifth proposed theme on benefit design processes. Again, there are many issues, and I'm just trying to summarize them here in these 4 key questions. How to ensure that the benefit design process is in line with the provider payment and also with the raised revenues. It's really about this alignment that came up through a couple of examples from your countries. Again, there's no blueprint, but one question a question that is relevant for all countries is what process and what criteria are useful or needed to set up an effective and appropriate benefit package, or just benefits as you may want to formulate it. And within that process, the key question is really how to involve all the relevant stakeholders. What decisions can be undertaken in a more participatory way? What questions are maybe more technical? And last but not least, and I think we shouldn't forget about that, and I'm really picking on a couple of responses that related to that issue. It's about the benefit obligations, namely, it's about the co-payment side. How can gatekeeping be strengthened? How can referral systems be strengthened? And to what extent can that be connected with co-payment issues? So with that, I have tried to give a very quick summary of the issues that were raised. And I guess, can I just see the next slide? Or maybe the next one even, if possible, and we come back to this one. Oh, No, it's not there. Okay, never mind. So basically, okay, fine, no problem. So really, I mean, what we would like to hear from you is how does that resonate? Does that actually reflect? Have you done a proper reflection of your responses? Do these overall, these core themes really match with what you see as priorities? For sure, many of the issues are interconnected, and it's a little bit artificial in a way to separate in different themes. And so just keep that in mind, that it doesn't mean that we want to work in silos, but maybe the approach is really to start focusing on a specific area and then explore in various directions, which will then touch again on other themes. And so I think it's very important that there's also some cross-fertilization across the various working groups. And with that, I hand over to Bruno. Thank you.